Thank you, Minister, and I definitely appreciate you saying that the government is going to fix sort of some of the backlogs in the system. Can you say specifically how you're going to do that? Will you be hiring more staff, this week? How soon could that happen?
Some of the issues are technical and caused by the sheer massive volume of calls. And so I think part of it is just speaking to people, and people will start to learn and understand the system. I think people in BC have responded every time we've asked them to contribute, and my expectation is that'll happen. And obviously, as call volumes decrease over the next number of days, that will increase the efficiency of everyone involved in the system. But as well as it's our expectation as we go through the coming weeks that we'll be adding resources weekend to week, and that will happen this week, and that will happen in coming weeks, because we simply have to respond quickly to people. This act of booking an appointment is for, I think, all of our people, particularly people over 90, people over 65 and their families. It's a solemn act, and so we've made real progress. Those groups, as I say, there's 47,000 approximately people over 90 in BC. Almost 20,000 have already been vaccinated, and a significant number, of course, and many thousands received their appointments today. But I think as we go along, we're simply going to have to respond better, because every time we go through a new category of person, there's going to be more people in that category. And once we get to the point where the online tool is ready for April 12th, when we go really broad in general immunization, that will help, of course, but we want to make sure we meet the test in the meantime.
Katie, do you have a follow-up?
Yes, please. I mean, could the online system be added sooner? Because there are some seniors who are saying, they're happy to learn the online system, or that they could do it, or that their family members who are booking on their behalf could navigate the online system like what's happening in the Fraser Health. So could the online option be added quicker to these the first groups?
Yeah, I think we need to be aware that there is quite a large project in terms of developing a seamless online and phone system for April. It was not possible. Obviously, we wanted it to be ready for weeks ago, but it does take time to get those things together. And Fraser Health was the only health authority that had that type of an online booking system that was robust enough at this point. But I will say that, the call center provider that has been charged with working on this needs to step up as well, as well as the health authorities, and it will get better. But the challenge we have is that we don't have a system that allowed us to do this seamlessly, that was pre-built, and it's unfortunately something that we're seeing across the country. And hopefully this will be a legacy system that will allow us to do a lot more in the future.
And Fraser Health has a system in place that a significant number of people were able to book appointments on today, and that was something they built out as part of their testing process last summer. And the overall system, the platform, will be ready for the launch of Phase 3 on April the 12th. And in the meantime, our expectation is that our call center system will respond well to people, and that means calling only when you're able to book an appointment. In this case, seniors 90 and above, and Indigenous people 65 and above on the one hand. But on the other hand, absolutely, we need to respond more quickly and better to people's calls, and that's already happening through the day, but it's our expectation this week that it'll get better every single day.
Oh, hi, guys. We'll start with Minister Dix. At your 10 a.m. press conference, you said you'd have information on the number of appointments that have been booked by this press conference, by 3 o'clock. So how many of those 80,000 or so seniors that are eligible starting now have booked their appointments? And also, can you give us a more up-to-date number of calls to the lines? You said by 10 a.m. it was 1.7 million. Can you give us a sense of where we are now?
So as I noted, of the roughly 80,000 that are eligible to get appointments in these categories, roughly in the neighborhood of 26,000 have already received them, so that reduces the number. It's my understanding that about 10,000 appointments have been booked to date. A significant number of those through Fraser Health's online site, as you'll know. And so that's about the number. And on the latter number, what we'll try and do is include that in the statement shortly, because as you know, it was building up through the day. But I think the 1.7 million in the morning gives you a sense of the sheer volume of calls we are facing. So those numbers will be available, and we'll continue to have updates through the week.
How are you, or what checks and balances are being taken to stop people from cheating the system and running the risk of alienating people who don't have ID, but yet again keeping casino bosses and their wives from lining up to try to get immunized when they're not eligible?
I think there's some very basic things. I think we know that the vast majority of people understand that we need to do it in a phased approach. And again, to reassure everybody who's in BC, it doesn't mean you have to have a PHN, it doesn't mean you have to live here permanently. Everybody in BC will get their vaccine in the coming weeks.
I think, Marcella, generally speaking, people calling into our call centers do have a personal health number, and if their age is, if they were born, not born in 1931 or before, this week they won't be able to book an appointment. Similarly with the age limit for Indigenous people. So I think we have ways in a general sense to control that, and we will. That's why we have an appointment booking system. And I think I just want to remind everybody this week who is eligible this week to book appointments that they have a number of days to do it. You won't lose a place in line. There's lots of vaccine to address the group of people over 90 and Indigenous over 65. We will be ready for you. There's lots of appointments, and if you didn't book an appointment today, you can book one tomorrow. But the issue of people gaming the system, when we hear that or we hear people not following public health orders, I think for all of those people who are following it is irritating. And I'm not saying there won't be any of those cases, but I do believe they'll be relatively few and far between, mainly because we have a community in BC that's been incredibly committed to working together to deal with the pandemic on the one hand, and on the other hand we have some controls to make sure that doesn't happen. We know that there's roughly 24,000 people in the category of long-term home support and community health supports that we're providing, in many cases, appointments in their own homes or in other circumstances. So that's happening this week. The first part of our over 80 plan and our vulnerable elders plan involved obviously long-term care and assisted living, and almost on all of independent living and seniors residences now, lots of other congregate circumstances, and lots of seniors have appointments this week, for example, who receive long-term home support and other circumstances. So there's lots of people who will be receiving the vaccine this week in these categories. And so in the group over 90, the number of people that need to book is less than the 47,000 entirely in the category. Some are getting them this week, and where there's available, we're trying to get people their vaccine as soon as we can.